Okay, so it's a lovely Tuesday morning right here on Fiila FM 89.3. And as we all know, Tuesday mornings like this, we come your way with our mental health show. And this morning, we are here to bring you our mental health show. So, welcome to the mental health show on Fiila FM 89.3. And let me remind you that we are live on Facebook. So join us on Facebook and also share for others to benefit from our discussion. Thanks so much. The house is full. And this morning we're talking about opioid use disorder. Opioid use disorder. So I have a full house. Barnabas is here, Shada is here, and also Emanuela is here. Together, we'll bring you the mental health show and then delve deeper into opioid use disorder. My name is Akusia Kwatma Boache, and many thanks to you out there also doing the listening and those watching us live on Facebook. So let me welcome my guests, ladies and then gentlemen. Good morning and welcome.
Good morning.
So how are we all doing?
Yeah, fine. Managing.
We are doing what?
Manager Sabaha. Manager Sabaha.
Managers.
Aye.
Every Ghanaian is a manager.
You see you. You see you.
Every Ghanaian is a manager.
Okay, so it's good to have you once again this morning on the show. So how did you people celebrate the Mother's Day? How did you celebrate your mothers? Or your mothers are not here?
This one, the Shahada first.
Hey, why me? Anyways, for breakfast I did toasted bread for my mom, and then for lunch I prepared fried rice.
Oh yeah.
Yes.
And for supper?
And topped it up with a drink. For supper, like the rice was still there, so.
Oh, okay.
Yeah.
So you really gave her a treat
Yes.
at home.
Yes.
That's great. Ella.
So my mom is not here, so I just sent her money to take herself out.
Okay. She should take herself out.
Yes, please.
Or do
Can you
whatever
mention
she
the
wants
money?
to do. Hers is to enjoy herself.
Yes, please.
That's
Can't
great.
you mention the money, AKB?
It's between my mom and I.
You should mention the money. Oh, now Barnabas Anati. Barnabas Anati.
Sana miti AKB.
And there's only the money asem. Barnabas. Now what's all your day?
Me bo special empire ma. Me ma menum. Our more my bravo more my boy me about bedrua.
Okay.
And you can't share some kakra to my bravos. Nyame more no more by my na.
Okay.
And your monkey you.
And your ma and cut your woo and pa. Yadamasi, Yakupon, Insha, Mopa, and my young mamminum. I almost Anyin say a bosume emkron ediaba asasi so ahweyen amayabe du ne yadria once a year honoring media we need to honor them. So on behalf of our mothers I say thank you for honoring them on Sunday. Thank you very much. So quickly let's come back to our discussion opioid use disorder. Opioid use disorder. Barnabas.
AKB.
What is it?
Very good morning to our listeners. With this particular topic, I'm actually passionate about it because there's a particular issue that we've been battling and we've been faced with almost every month. We have someone coming to a couple of people coming to our place with some of these conditions. And the people that come with mostly they are the young people, the youth, that we are hoping that these guys will be very active and work and make sure that Ghana will be developed. But we realize that they are being affected with this particular condition. So if you talk about opioid, in a layman's term, what it means is that they are just a group of medications or chemicals that are used to treat pain. So that is how we are going to put it. So if you talk about medications or things that are used to treat pain, then we can talk about the common tramadol that we know. So you can't opioid now. It is a broad name which includes tramadol, heroin, morphine, and other drugs that people are using on the street.
Okay.
But this opioid that we are talking about, AKB, it wasn't entirely a bad thing. Opioid are actually prescribed in the hospitals. As we are speaking currently, we prescribe some of them in our hospitals, but we prescribe them in certain instances. So, for instance, if someone undergoes a surgery, normally after you come out from surgery, the pain sometimes is very, very unbearable.
Yeah.
So we give these kind of drugs to make sure that we subside the pain for you. Also, there are people that unfortunately get involved in accident. Sometimes they have to amputate their leg. Sometimes because of the injuries of the accident, the pains are so very unbearable that you have to find a medication that will be much stronger to subside the pain.
Okay, yeah.
So we prescribe those things in instances where people get involved in accident, serious injuries, and after surgery. But one thing is that we've realized that instead of now the drug being prescribed only in the hospital, people are now using it on the street. So ideally, opioids are not a bad thing,
Okay,
actually.
okay.
But it is the use of it that currently,
The abuse of
yes,
it.
the abuse of it that have made it bad. So, for instance, the commonest one that people know in Ghana is tramadol and pethidine that people are also abusing.
Okay.
So, opioid in itself is not a bad thing, but the use and the abuse of it makes it bad. And also, once people are now using some of these substances, there are other ones that synthetically people have also manufactured and they are also using it in the system, artificial ones. And those artificial ones are even more deadlier than the ones that we prescribe within the hospitals. So when we talk about opioid use, I'm going to break it down, then we come to the disorder itself.
Okay.
Before we say you have an opioid use disorder, that is if you are taking tramadol and we are saying that the tramadol intake has become a disorder, it starts from somewhere. It starts from what we call opioid dependence, okay, or you being dependent on the drug. So when we say you are dependent on the drug, what it means is that if you were using one tablet to get that feeling of happiness, to get that feeling of smile and feeling of goodness within you are using one tablet every day. It has gotten to a time maybe you have to increase it to 2 tablets
dosage, yeah.
to get the same effect that you were getting previously. So that is what we talk about. That's what we mean by you have become tolerant. So in our term, you say tolerant. So it means that you have to increase the drug to get the same effect that you started with.
Okay.
So if you started with 1, you realize that as time goes on, you have to increase it to 2 or 3 to get the same effect that the 1 was giving you. So what it means is that your body has become used to the 1 to the extent that if you only take 1, it is not going to be able to provide you that joy, that effect that you are talking about.
Okay.
So me talking about effect that people get from this, it is something that we call euphoria. And euphoria means that feeling of happiness, feeling of joy that people get. So this drug that people are abusing, they are abusing it because of the feeling of happiness that they get from the drug. That is why a lot of people, a lot of young guys are chasing this tramadol and other things that are on the street. It's just to feel good about themselves. So imagine you have not done anything, but you want to feel good about yourself.
Yeah,
so that is the feeling good. The feeling good that
so
people are actually chasing on the street, and it is leading us to this. So also with tolerance, we also have something that we call withdrawal. So with withdrawal, what it means is that you realize that you've been increasing your usage for a time now, for a while now, and has gotten to some extent, you tell yourself, it looks like I'm wasting too much money on this drug, so let me see whether I can stop. So the moment that day you say you want to stop, then you realize that yes, you become very weak, you are sweating, your body is shivering, you are having headaches, severe headache and other things. Then quickly you go back to take it. So that means that when you try stopping, your body has realized that no, you've been taking this substance for a very long time. Now you are telling me that you don't want to take. No, I have to do something for you to know that no, I want you to
still
introduce
need it.
Yes. So that is the withdrawal symptom that people experience.
Okay.
And because of the withdrawal symptoms, that is why a lot of people find it very difficult to stop the use of opioids or to stop the use of these substances. And I must say that with this substance that we are talking about, the reason why it is very addictive is that when it goes into our system, as normal human beings, God created us and kept something within us that if you do something and they praise you, you become very happy. If you do something and someone says something good about you, you become very happy. And we all know that kind of feeling. You doing something and people are saying, "Oh, you did well, you performed well." You feel very bossy. Utia kono sa adwemo. I yes kono sa adwemo. Yeso anasa na kano. So you feel very big about yourself, and that good feeling that you have is that same way if you take the opioids that you are talking about, the tramadol and other things. That is what it goes into our system.
The same feeling you get.
Yes. So it goes to suppress the feeling of pain that ideally people will experience and make them feel very good about themselves. And that is the effect that the drug is giving. But the issue is that under normal circumstances, any drug that easily triggers our reward system to make us feel good, it means that that drug can be addictive. So that is why alcohol can be addictive, tramadol can be addictive, marijuana can be addictive. So all these drugs that people take, it has the probability to easily trigger our reward system to make us feel very good about ourselves. And already everyone wants to feel good about themselves. One person was sorry, we are see we more. One the person not the be an now everyone wants to feel very good about themselves. So anything that has the probability to trigger that feeling good sensation has the probability of also being addictive to that individual. And when we look at opioid use disorder, for instance, presently we are seeing a lot of youth experiencing this, but the condition is not restricted to only youth. It can be grown-ups that are experiencing that grown-up that could experience it. These days we are even having young guys, even at the age of 15, 16, JHS level, abusing some of these substances. So it's not only between the young people who are maybe above 18 years that are experiencing this. And this is also not a respecter of race or whether sex. Females are also doing this. Yeah. And sometimes you'll be surprised. Sometimes parents come and they feel like they follow their female daughters to the facility. And when you try to ask some of them about whether they are taking drugs, their mothers will quickly jump in. Oh, my daughter, she doesn't do those things. She doesn't do those things. So sometimes
you wouldn't know.
So
you wouldn't know. Yes.
Oh, my daughter cannot do those things. But the moment you tell the mother,
it's not like the weed or maybe you're not general or cigarette are not general.
That is it.
You know even.
Come on. Yes. Your friend is a Roman sister. No, bet now. You know him so when in na show. And so you may go video.
Or you will fear
soon. Or you will fear pants. So sometimes if you let the mother excuse you and now you begin to interact with the young ladies, that is when you see different kinds of skills. And you know, you women are creative. They can use it to do different kinds of things that you can never even imagine, and those kind of things. So tramadol use disorder or opioid use disorder is not a respecter of race or it's not a respecter of sex. So whichever your economic status or your economic level, you can be affected. So it doesn't matter whether the person is poor, whether the person is rich. And someone will even say if the rich people are doing, they have money to buy it, but poor people are also doing it. So it's not a respecter of economic level as well. And when we look at how opioid use disorder also present, we realize that most of the people that come to the hospital and we prescribe some of these opioids to them. So for instance, the tramadol, the petidine and other things that we prescribe to them, about 3 to 19% of them end up developing this opioid use disorder. So it means that we as health workers too, there is much work for us to do, because sometimes when we prescribe some of these drugs to the patient that come, sometimes the supervision is low, and once the supervision is low and you don't monitor it well, it could mean that you, the health worker, could predispose the person to developing the condition. And I must confess, there are some people that develop this condition because they were prescribed the medication at the hospital, and after they left the hospital, they continue and they become addicts to this hospital. So that is the negative aspect of our work that I think as health workers too, we need to take a look at it and also focus much on. And the last thing that I want to talk about is that opioid use disorder, why we are coming here this morning to talk about it, is that you can die through it.
Oh, okay.
Yes. So you can die through the overdose of it. And if you take an overdose of it, and for instance, you are not lucky to get someone that can send you to the hospital for
Immediately,
it
yeah.
to be mitigated upon, it means that you can die. And it has been estimated that about 120,000 deaths occur worldwide due to opioid use abuse, opioid use disorder. So people that use these substances, that is tramadol, pethidine, and other things that we are talking about now, about 120,000 of them die every year, which includes Ghana. That they die every year, which includes Ghana. So there is something serious that we need to take note of. And these days, we see a lot of the signs and symptoms of people who take it and the way they are behaving on the street. So what we want our listeners to understand is that when we talk about opioid use disorder, there are these medications that we are using to treat pain, but people abuse them to the extent that it causes them distress in their life, and they find it difficult to control that distress, and they still see those clear signs of issues in their life, but they still go ahead to still take the substance despite the clear issues, liver issues, economic issues, relationship issues that they face in their life. They still go ahead to still take the drug, which cause them further issues. So AKB, this is what we mean by opioid use disorder.
Okay, Barnabas, thank you so much for taking us deeper into what opioid use is. Let me come to Shada to take us through the symptoms and signs of opioid use disorder.
Okay, thank you. When we talk about the signs and symptoms of opioid use disorder, we can talk about taking large amounts of opioid opioid use, or taking them over a longer period than prescribed. Maybe you went to the hospital due to something that you are going through, and then you are prescribed a painkiller, and maybe you are asked to take a tablet or two, maybe daily or even after meals, but you find yourself taking maybe 8 to 10 tablets, or sometimes maybe more than even the whole sachet.
Okay.
Then you realize that this is a disorder. Or maybe you've been asked to take this drug maybe for just a week, but you find that you are taking it for more than 2 weeks. Yeah, in fact, it's now like part and parcel of your life. You can't do without it. Then that is a disorder. And then having a strong desire or urge to use opioids. Most of us, we don't like taking medication. So when it's time for us to stop, we are even happy that we don't have to take them anymore. But here is the case: you can't resist the urge. You feel like your body is always itching you to go and take it, though you have no pain, like because of the fact that your body has become used to it. Yeah, your body is always giving you, signs that you should go and take the medication, otherwise you're not going to be okay. And then having unsuccessful efforts to cut down or control opioid use. Sometimes people get to a point where they realize this thing is causing more harm than good to me, and I really want to stop, but it becomes difficult because they experience withdrawal symptoms. So when you realize that you're finding it difficult to stop the use of opioids, then you realize that this is a disorder. It's no longer normal. And then having issues fulfilling responsibilities at work, school, or home due to opioid use. Most people take the drug because of the feeling that they derive from it. Some, after taking it, they feel it's like they are not themselves. So when they even go to work, it's hard to do what they are supposed to do. They are not able to concentrate, fulfill their task and all that. Then you realize, okay, so this is now affecting my work life and all that. So it has become a disorder. And then continuing the use of opioid, despite having recurring social and interpersonal issues, you realize that after taking opioids, maybe you do things that destroys your relationship with others. Maybe you start talking anyhow, you start acting in ways that you usually don't, and realize that this is affecting your life. Like, it's making people stay away from you and all that. It's making people talk bad about you, but you realize that you are still doing it despite these negatives. Then you have to now tell yourself that, okay, so now this is no longer normal. it has become a disorder and I need to find help. And then continuing the use of opioids, despite physical and psychological problems, sometimes people realize that every drug has side effects.
Okay.
As I always say, just that we are usually not told, and maybe it's because we don't ask. But I realize that this drug,
People want us to ask before you tell us.
yes, so you realize that after taking this drug, it's having effects on you physically. You are seeing changes that wasn't there, but you are still taking it. Then you have to know that there is a problem, and maybe psychological too. It's not affecting you. Maybe after you take it, when the drug leaves your system, you realize that you are no longer yourself. Maybe you are withdrawn and all that, but you still go ahead to take it all the time. Then at this point it is now a disorder, and then it is very important to seek care as soon as possible. Maybe if you didn't know that this was or these were signs of the disorder, then now you know you should seek help. If all these things I've mentioned are, showing, and then you were previously confused, now you are cleared, you can seek for help. So these are a few symptoms.
Okay, thank you very much, Shada. So Shada has taken us through the symptoms and signs of the opioid use disorder. So Manuela, you take us through the signs and symptoms of opioid overdose.
Okay, thank you. So first of all, when we say somebody has overdosed something, it means a person has taken more than the person's system could handle.
Okay.
So here are some of the signs to know that somebody has overdosed an opioid. First of all, the person becomes unresponsive or unconscious. It's not in any particular order. I'm just mentioning some of the
Okay.
things you might notice in someone. So the person might become unconscious or unresponsive. That the person is only, you are waking this person up, the person is not waking up. The person, you can't do anything for yourself. You are just there. So another thing could be the person's breathing becomes slow or shallow. So opioid use reduces it slows down, it can slow down a person's breathing. And here's a case where the person has overdosed it, so at a point the person's breathing begins to also slow down. Also, a person's pupils could become smaller. When you see the person's eyes look like they are going back inside.
Or when they were inside.
Oh, got it.
So yes, the person's eyes become smaller than usual.
Okay.
Another one to notice, the fingernails, the tips of your fingernails, they change in color. They become either bluish or purplish. Your fingernails and ear, and then also a person's lips. I don't know. Whenever we watch movies and then somebody has been exposed to cold for a very long time, the person's lips start to become. They look like they are changing in color. So yeah, when someone overdoses some of these opioids, those are some of the things that could happen to the person. Also, a person's pulse could become weak. On a normal day when your heart is beating, sometimes when you touch your chest you can feel it. But here's the case where when it happens like that, you don't feel the person's pulse again.
Okay.
It has slowed down, so and it's very difficult to detect. Another sign we should notice: confusion and drowsiness. You are there but you don't even know that you are there. You are, yes, you become confused, you become unresponsive, you become somewhere be. Yes. So here are some of the signs you should note out to know that maybe a person is going through an overdose of an opioid. And when something like this happens or you notice this in a person, it's important to seek help because it could be very brutal. The person could lose their lives as a result.
All right. Thank you very much, Ella. So coming back to you, Barnabas,
Yeah.
what are the causes or risk factors of opioid use disorder?
Okay, so we have various categories of risk factors and causes that we can look at. So with opioid use disorder, just as other forms of mental conditions that we normally talk about, it comes with varieties of symptoms, and for instance, the causes or the risk factors that we are going to talk about, it does not mean that, for instance, if some of them are present within you, then it means that only that one could trigger you. But in certain instances, that could be one of the precursor of it. So with opioid use disorder, just as other mental conditions and other addictive behaviors that we know, one thing that we know for sure is that mostly a lot of people that abuse substances or that get addicted to substances, when you go back into their history, what you realize is that they may have a relative that was also once an addict to those kind of substances. Sometimes someone will say, oh, but tramadol is just something common that people know it for now. So if someone is addicted to tramadol, sometimes what we see is that if you go into the person's history, you might realize that maybe one of the person's family members were addicted to cigarette or were addicted to alcohol. So cigarette, that's tobacco. So that is how it presents itself. So it has that genetic meaning or genetic connotation that we can talk about. Then also we can also talk about how it also affects our brain chemistry. So earlier on, when I was describing opioid use disorder, I said it goes to triggers the reward system. And when we say it triggers the reward system, it releases a particular chemical within our system. And because opioid has an easier way of actually making that substance present within our system, it makes us easily to feel happy. And who doesn't want to feel happy? Everyone wants to feel happy. So once people want to feel happy, because of that chemical, because of that easier reaction that it can provide us, people continue to take the drug because it can easily make them feel happy. They don't need to go through the big work, the big the difficult tasks to be praised for them to feel happy. So they can just easily trigger it through that system. So brain chemistry and how our brain works due to opioid, when opioid is also introduced into the system, can also be a risk factor or a cause of why we develop opioid use disorder. And I must say this, talking about how opioid affects our brain chemistry, most of the time, sometimes when you interact with people who abuse substances or people who think certain substances are okay and we can abuse them, their argument is mostly that but this person has been taking the substance for like 5 years. This person has been taking it for since the person was a child or whatever that it is. One thing that we should know is that our system is different. Every person has a different system and has a unique way of responding to things. So if someone has done it for more than 5 years and has not seen any effect on it, that does not mean that you can also do same and will not realize any effect on it. Remember, the way our system responds to things are different, and that is what we should be focused on. And we know that this substance can cause you an issue. So instead of you to wait to do the substance and say, oh, I'm waiting to see whether it will cause me the issue or not, why don't you stop all along, not to even wait for the issue to be caused? So we should know that the way our body responds to some of these substances are different. And also, depending on your exposure and access to opioids, it could predispose you to developing opioid use disorder. So when I talk about access and exposure, so exposure could be if you are working or you are mingling with people that abuse opioids, there's a more likelihood that they may influence you, yes, to take it. Sometimes, normally when we talk about peer influence, sometimes the perception of people is that, oh, it's all the time that your friend will tell you, oh, Barnabas, take this, and you also took it. No, sometimes psychologically you can also be influenced. So you are with people, and within our psychological setting, we know that even within a group, you just being in a group can influence your behavior. So you are within a group, and these people are taking these substances, and you see them. That is the identity of the group, and everyone within the group wants to be identified as part of the group. So you want to be identified as a group member, and if that group, you smoking substances is what identify you guys, what will you do? The easier thing is for you to do is to also smoke that substance and also be recognized as one of them, so that they will not look down on you or they will not see you to be different from them. So they will involve you in their decision making and everything that they do. So that is also a form of exposure. So you being around it, and also at first it wasn't easy for you to easily get tramadol to go and even purchase, even if you're holding a prescription. It was very difficult for you to get it even out of the pharmacy. But unfortunately for us now, I don't know whether we've losing some of the restrictions or some of the guidelines we on it. It's easier for people to get it now, and also our borders too. The people patrolling our borders and the people who are to take care of some of these things. We easily get these substances getting into the system. And I think recently there have been a documentary on some of the sister stations that were talking about how tramadol actually gets into Ghana, and Tamale unfortunately was highlighted in that video. And the people were talking about how they cannot send those drugs to Nigeria, but in Ghana they can easily bring it into. Yes, because it means that our system, our border patrol system, there is some weakness there that we need to also take note of. So if the thing is even available on the market, then there's a more likelihood that if the person wants it, they can get it. But if it's difficult to get, then it means that a lot of people are not going to have access to it, and they may not end up developing opioid use disorder. Another risk factor or cause of opioid use disorder could be a mental condition or a medical condition. So when I say a mental condition, example is that sometimes people have issues of anxiety. People are going through some form of depression, and because of the anxiety, because of the depression, people have this thought that, oh, let me just take the substance and forget about my issues. It doesn't really work that way. So because of that thought, people end up taking substances that will make them feel like they've forgotten about their issues. So if you are someone that is practicing it, or you want to actually escape your issues and you are using substances in that direction, you could be using an opioid that by the time you realize, you become very addicted to that particular opioid. And in this instance, it is the mental condition that has predisposed you to developing it. A different way could be you being involved in an accident. So just as I said, we normally prescribe it when people have serious injuries and other things, or surgeries. So when we prescribe it in these instances for you, and for instance, sometimes too, the way we take the prescription, we prescribe it for you, they tell you to take it for only 7 days. After the 7 days, it was this drug that the doctor prescribed, so I know the drug, so let me just go and get it. So you go and get it yourself, and you are also taking it. Okay, that could also predispose you to developing it. And also another thing is that we've realized that some of the painkillers now, they've included different varieties of substances in there. So some of them now, you can see even caffeine in the painkiller. You can see tramadol, then you can see paracetamol. And people buy it and say, oh, this one is very good, it's very strong, and other things. I know someone that showed me one of those things, and the person wanted to know whether there is tramadol inside. So lucky for the person, there wasn't tramadol, but there was caffeine. That is also another thing to talk about.
Caffeine, there's something to mean that.
But you see, caffeine also has a likelihood of also reducing pain. But you see, all of them has to be done in moderation. Just as we are talking about how tramadol can be used, it also has that dynamics that also helps in the management of pain. So some of the normal painkillers that people are selling on the street, our pharmacies, our drugstores, some of them
they
also
are not
contain,
that normal.
Yes, some of them also contain tramadol.
Okay.
So if you go over the counter to buy some of these drugs, to try to look at the drug that are in it, or even if you can't read, ask the person, the particular drug you are giving me, does it contain tramadol inside? If it contains tramadol, you tell your person to change it to a different one that does not contain tramadol for you, because tramadol in itself is reserved for serious injuries, for treating serious pain, as we talked about. So a medical condition can also lead you to developing opioid use disorder. And sometimes adverse childhood experience. With adverse childhood experience, it runs through a lot of mental conditions. Sometimes some people go through some very bad and terrible childhood, and because of that, people want to actually hide, or they don't want to even remember what they went through. So because of that, sometimes when those memories are coming, when those thoughts are coming, they try to engage in substance just to let the incident pass by or to swing by. And with this, if it continues or if it persists, it can also predispose the person into developing opioid use disorder. Sometimes people were neglected within their childhood, and because of that, as they grow, they still have that sense of neglect. They still have that sense of difficulty in building a good relationship. So those issues that could develop within their adulthood or within their matured period could also be a precursor for them to just go and take the substance and forget about the things that they are going through, which we want to tell our listeners that if you take the substance to forget about those things, it actually doesn't go away. You just postpone the issue for some time, and after the substance fades from your system, you come back to it and you have to face the issue. So if you're having an issue that is causing you worries, is causing you a lot of sadness, what is important is that you face that issue and solve that issue instead of we normally relying on drugs to help us overcome those things. It doesn't really work. So AKB, these are some of the causes and the risk factors that we can talk about. So we have to pay attention to some of these things.
Okay, thank you very much. So, Shada, let's look at the treatment of opioid use disorder.
Okay, so
Can it be treated?
yes, it can be treated, and then so as part of the treatment, we have psychotherapy, and under the psychotherapy, sometimes you can use cognitive behavioral therapy. This is a goal-oriented therapy where the psychologist seeks to help you unlearn your negative thought patterns and behaviors, and then adapt more healthier thinking patterns and then behaviors. So let's say that so when you go to a psychologist, they first make you set a goal. Okay, so as you have come, what do you want to achieve? Then maybe I want to stop taking opioids because
Okay.
I've realized that it's affecting me a lot. And then they maybe they ask you why you take it, and then you say that so maybe anytime you have a fight at home and then it's bothering you, you can't seem to forget about it, you just take that drug because it makes you forget your problems. Then they help you see the positive side of what happened. Maybe not every situation will have a positive side. Maybe your people complaining is because you've done something wrong. So you can look at it in a positive light, in a sense that you can say, okay, so I did this, that's why I got this feedback. So if I don't want the feedback to come, then I have to do what is right.
Okay.
Some might not interpret it this way. They rather feel like maybe they don't the people giving them that feedback doesn't like them or don't like them. So the only way is to turn to their only friend, which in this situation is the opioids. So they help you change those thought patterns, and maybe instead of going to take the drugs to make you forget your problems, they can encourage you to hang out with friends or anyone that you feel if you're around, the person can make you happy. Sometimes they even encourage you to do the things you love. Some of us, as a way of relaxing, we sometimes watch movies or listen to music. So they ask you what you like doing, what helps you, get things off your mind, and then they encourage you to do those things instead of taking the drugs. So yeah, psychotherapy, and then under which cognitive behavioral therapy falls can be used to treat opioid use disorder. And then we can also talk about self-help programs
Okay.
for opioid use disorder, like such as Narcotics Anonymous. Maybe you join a group where no one knows your identity, but you find people sharing their stories, what they go through, and maybe a coping skill someone is using that is helping. So from there, you realize that you're not the only one going through this. You are a lot, and then there are a lot more people that are ready to seek help. Sometimes it gives you hope, it encourages you, and you can learn a few things from them. Someone can share the techniques that they are using, which is helping them. So you can also pick it up and then help yourself. So that one too is like you're helping yourself get like treatment. And and sometimes when you hear people's challenges, sometimes it makes you even feel like yours is not that serious. And if someone is going through a much more serious thing and is doing something about it and can come out of it, then why can't I also come out of it? So it has positive effects. And we can also talk about medications. Some people might wonder why a medication is going to be used to treat um another medication, problem. But here is the you'll be prescribed drugs that will help reduce the craving. Here's the case, like you have an urge, you have the craving to take that drug, so you'll be given a medication that will reduce the
The
craving.
craving, okay.
Yes. And yeah, and also the side effects that comes with the withdrawal symptoms. Maybe when you try to stop taking the drugs, the symptoms that you experience, you'll be given a drug that will stop those symptoms. Or maybe some of the symptoms that the drug you're abusing comes with, the drug you'll be given will use to, you know, reduce those symptoms. So a combination of all these three can be used, depending on your treatment plan. Just maybe one can be used. Someone too might try to combine a three. So yeah, these are some of the treatments for opioid use disorder.
Okay, many thanks. They say prevention is better than cure. So, Ella, let's talk about the prevention. How can we prevent that?
Okay, KB. So, with the prevention, I'll first of all speak about what the healthcare provider can do, and then what you as the patient can also do. So, I'm starting with what the healthcare provider can do. So, with prescription, most of the time when you go to the hospital, it's the doctor that prescribes the drugs for you. So, as a doctor, what you can do is to engage in responsible prescribing practices. As Barnabas was speaking, when he was speaking, he mentioned that most of the about 3 to 19% of people who have been prescribed with opioids in the end become addicted to it. And I believe it's because most of the time when you are given the prescription, you allow the person to take the drugs at home. And when when after that, the person can just go and get some to buy anywhere when the person wants to buy it. So it's in this case, when you're prescribing the drugs, you prescribe it in say a minimal quantity, and also ensure that say your patient is taking these drugs at the hospital. And it shouldn't be okay, I've come out of surgery and then I'm in severe pain, so petidine, so I leave the hospital. At this point, the person might become addicted to it even before the person leaves the hospital. So yeah, it's important to regulate it. If the person is in severe pain, you look for other ways of managing the pain rather than immediately going to prescribe one of the strong pain medications. Also, another thing that could be done is to educate patients on the drugs that they are taking. Most people, okay, they hear every day that you can get addicted to the drug, you can get addicted to the drug, but the person feels like, as long as I have taken it and then it is relieving pain. What do you mean by addiction? I'm in pain and I'm taking the drug, so what do you mean by I am addicted to it? So you educate your patients on the consequences of taking the drugs. Most people don't even know that after a long period of time, the drugs could um, do something bad to them. So it's important to give people education. And when you are giving the education, sometimes we tend to sugarcoat our words because we don't want to sound harsh. But with drugs and things like this, I think we are supposed to, if you take it plenty you will die. Tell the person, if you take it plenty most people are scared of death. So you tell the person what the person needs to know, and also as the patient what you can do. Most of the time we don't take the drugs as our healthcare providers have asked us to take them. So if say you are supposed to take one tablet, ensure that you take one tablet. If it is not relieving the pain, you don't just go ahead to take another tablet. You contact your healthcare provider, or any healthcare provider, any trusted and well licensed healthcare provider around you, to see if there's a different alternatives. Also, if you are given a drug, make sure to check the instructions every time you take a dose, to ensure that you are taking the dose the same way you are supposed to take it. And when you start to feel like you are getting dependent on the drug, that you don't feel comfortable when you don't take your drugs, as long, I mean, the moment you notice it, it's important to seek help, because if you see that you're not comfortable when you don't take the drug. Maybe you feel like it's because it's supposed to relieve something, but it could be that you've started to become reliant or overly reliant on the drug. So it will be important to seek help. Like AKB said, prevention is better than cure. So it's important to prevent yourself from getting addicted to the drug before anything bad happens. So thank you. These are some of the ways you can prevent opioid use disorder.
Okay, thanks very much. So, Barnabas,
AKB.
how can, because these people they need help. Oh.
Yeah, they need serious help.
So, how can we help such people who use opioids?
Okay, so thank you very much. People who are addicted to opioids or people who use opioids, it's very, it's a very challenging condition, and there have been instances where we have relatives talking about how their brothers, their children, the small money that they will go and work and get, they use all of them to buy these drugs, and they come back to square zero. So we realize that this is a serious
Not
condition.
even square one, zero.
Zero pa bibien or nina we are there. So with this, the moment you see it, try to speak up, try to talk to the person about the condition. Don't wait and be hoping that I feel no washa sentino obejai. The moment if you react early to talk to the person about it in order for you guys to seek treatment, that is when you can be able to get better results. So we shouldn't wait for it to get worse. So the moment we see that there is something that your child, your relative that is going through, you realize that these days he has been buying some energy drink and putting something inside, grinding it and those kind of things and putting it inside, then you have to talk to the person. So it is important that we quickly approach those people and have a conversation with them. And in the conversation, if you start by accusing the person, being annoyed, this one day we are all at fault. Sometimes it's difficult to control our emotions, because especially if that person is someone that you've actually invested your money into, your time, your effort and everything. So imagine you've invested your time, money and everything into your child, and this child just got to university level 100, came back to the house, you realize that the child is doing drugs. It will be difficult for you to control your emotions, to just go and speak to the person calmly, especially if you're a man. Your first instincts will be like, the way I will beat you and those kind of things. But the moment you are trying to be harsh on the person, you may not get the person's reason for doing that, or what is pushing the person into doing those things. Remember, we said even having a mental condition can be a risk factor or can be a cause for you to go into some of these things. So we need to approach it patiently. So in that instance, we have to be empathetic in trying to approach them, in trying to communicate with them about this condition. Already the person is into it. So if you don't follow it in a very good manner, it's either you are pushing the person away from you, or you are able to bring the person. So we want us to be able to bring the person closer to us. It is when the person is closer to you that the person will be able to talk about their struggles. The person will be able to talk about the difficulties that is pushing them into taking some of these things, so that you'll be able to understand them in that process. And the one thing that I want us to also notice, that we have to be patient in all these instances. There are times that the things that a person will be saying, you don't agree with it, but for the sake of the person to feel that you understand them, and it also pushing the person to be able to follow up for treatment, let's just be patient and listen to, in quote, if it is whatever nonsense conversation that they are saying, let's just listen to them in that regard. Let them feel that we are there for them. Let them feel that we are listening to them. It's when people feel that we are being listened to, that is when they have issues that they will continue or be motivated to continue to come to you to seek that help. So the moment the person feels that, for this my uncle, for this my mom, whatever that I have, I can talk to the person about it. If the person goes out and even goes to take the substance, the person can come back and tell you that, today when I went, I couldn't control myself. and this happened and I had to go and take.
Okay.
So if you are able to engage in that meaningful conversation, that is when you can even be able to suggest ways for the person to help the person stop the intake of the substance. And after we are doing all these things, being patient, being empathetic, and also talking to the person to seek help or on the use of the substance, you the individual also involved, you have to also take good care of yourself.
Okay.
So in that instance, if you are providing the help, you have to also make sure that you are also taking care of your emotions. Sometimes the issues that we go and sit with people to talk about and discuss about, you are helping the person process those issues. What about you? You have to also deal with your issues. So you have to deal with your issues. If there are some form of emotions, you are being worried about it, you can find a way to also find someone that you trust to also talk about it, to help you reduce that emotional issues that you are going through. Some of the people that come, they came because of the withdrawal symptoms and they don't want to stop.
Yeah.
They've not decided to stop. So the moment the person have not decided to stop, you just provide that treatment, reduce the withdrawal symptoms, the person gets that strength, goes back. That's all.
And finishes with the fasting. And then go back.
That's all. Oh my
Wow.
God. So we wait another year, fasting period.
Then they'll come.
Then they come again.
Hey!
So we have people like that. That we are just managing.
So they are able to, postpone it and stay away from it
for some time.
For a month.
So the issue is that you cannot just stay away from it.
Yes. They're able to start it.
And they start for some time.
Yes, and then they go back into it.
Yes. So within that period that they come to the hospital, we prescribe some medicine. So it reduces some of the withdrawal symptoms, the difficulties, and those things that they will experience. So when the fasting is over, we don't see them again.
Wow.
Then they go back to the usual business, and another year they come back again. So I've not been here for long, but this is my 4th year now,
and it's been happening that way.
That is the trend that we are beginning to see.
Oh, okay.
And we are hoping that people will actually come forward. And the truth is that yes, we do have some people that genuinely come and they tell you, even if you have a rehab, that they can lock me in a room. You just tell me I want to go there, and they lock me. And those people, when you have the will, it's normally easier. But some people, it is some father that is annoyed with him that have dragged him to the hospital. That is where sometimes the difficulty is. Because you can't force the thing out of the person. And you can't follow the person all around. You can force
the donkey to the riverside.
That is it.
But you cannot force the donkey to drink the water.
So the moment the person tells you, oh, it's just 1 month, it's just 2 days, send the person to the health facility, and the appropriate care that is needed will be provided to that individual.
So this morning we've been talking about opioid use disorder, and trust me, it's a very, very serious issue, especially among youth. They are really, 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 really abusing substances. They are really, really abusing the substances. And as they said, if you are a parent these days, you will not see them. First, even if you don't see them and they come, you hear the scent on them, so that you immediately know that yes, my son or my daughter is doing drugs. Even I know it's when they smoke maybe a cigarette or weed that you hear. But if they don't smoke and it's these opioids they are talking about, these drugs that they combine them, when you see them holding a energy drink, any energy drink kekeo, and my idea gum, no. So as a parent, if you want to hear the scent or see them feeling gadochia, then by the time you realize, no, not a trim. As Barnabas said, they'll bring them to the hospital, and when you, as a parent, said, no. I remember, I don't know if it was you I told, if someone called you or came to see you, that's what they called. Oh, that this is what the child has been doing. And I asked, is the child using drugs? That no. I said no. Okay. If he's not doing drugs, when you go to the hospital, you know whether he's doing drugs or not. So I remember I gave your number because they said they've been listening to the program. So I gave your number out to them. So it's a very, very difficult thing. The way these days things are no. Say nyankopon pa na ebebie wani amu wo hu a, it is difficult to know.
It's difficult to know.
It is difficult to know. You are living with the child in the house. Unless maybe it gets to the stage that it becomes now visible on the child that yes, this child is really doing drugs. If not, you never know.
Yeah.
And by the time it gets to that stage, and I just say, what try be careful.
And even these days, I even heard Sobolo cry. To see I'm I shall say
the wigum.
I did a name and be a gum. What? Tafribomski. What's that?
That's what it's called.
The Sobolo one is Tafribomski.
Yeah, that's what it's called.
They'll do the Sobolo drink and then put it inside. This time they'll tell you no drinks I won't infusion. Ayo, yeah, infuse you.
And you.
Hi, na back on the we friend friend say. Omo odi bi ayo mo de friend no. Laka. Any sam your money nyanti no. Yes. Enti no upie na say unnim sankrofo na anu mu nam no unnim omo pa. No me sankrofo nom koma bibi na anom. Udu ti na be na ndia go.
Adiato. And it has happened before. People just follow people and they are taking some too.
Oh, I miss me no.
Let me just take some. By the time you realize wow.
Me am tell.
Only number.
Me am come tell. Hey. Noodles, any jollof.
Hey.
My point why na em say ye ka say be yi nsem na pia ye nkone because it's a very 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 serious issue. It's a very very serious issue that needs an attention, especially from parents, if not because it's you when you are able to see it early that you can talk to your child, and if there's any help the child needs now, you seek for that help early enough. Hey, Shara, let's speak your last words and go. Why?
I'd just like to say good morning to our viewers and listeners, and thank you very much for making time.
Thank you, Shada. Ella.
Okay, so as we are on the topic of parents, I think our parents should make themselves more available to their children so that when they are going through something, they can easily open up to them rather than going to open up to friends and somebody will tell you, oh, I know this drug, if you take it, you stop feeling the way you are feeling. Anyway, so on this note, I'd like to say a good morning to all our listeners, particularly Opoku, and thank you to Fiila FM for giving us the opportunity to be here this morning.
Opoku, wherever you are, good morning to you. I'm also extending my greetings. So in that direction, I wanted to say hello to one man that I met. I think AKB, you gave my contact out.
Okay.
But forgive me if you are listening. I know you are listening, so forgive me. But I'm saying hello to you. I know you know the one that you know that you are the one I'm talking to. And I want to say a good morning to my in charge, Mama Yvonne. They've been supportive. They've been helping throughout this process. And also my HR back at West Hospital, Madam Getty. She also likes this program and also follows. She has also been following. Just as Ella said, we thank Fiila FM for the opportunity. And I also want to say, Captain, wherever he
Major.
is, it seems, hey, Major,
wherever Major is.
Wherever he is, a good morning to him. We saw over the news that they've given them some medals. So some medals need to be pony one. So I'm waiting for that.
Oh my, you so fire them. Right.
So I just want to say, with some of these conditions, the good thing is that we can have ways that we can use to manage some of these conditions. So if you are out there, you want to stop, you are abusing tramadol, you are abusing weed, you are abusing any substance, and you now know that where it has gotten to is causing you issues and you want to stop, you can just walk into any of the big hospitals around, SD Hospital, Tamale West Hospital where I work, Tamale Teaching Hospital, Central Hospital, wherever that there is a mental health unit. We are always welcome to receive you and make sure that we provide you the care that you actually need. So we are waiting for you wherever that you are and you have this issue. We are always going to welcome you and make sure that you are treated well and catered well for AKB. So thank you very much for the opportunity.
Many thanks to you as well. That has been Barnabas Atangongo from Tamale West Hospital, Tembil Yinpala, Emanuela, and also Asuma Shahada to Brima, all from TTH Psychology Unit. Thanks to Kumsin Matthew for the Facebook Live. Thanks to you out there for doing the listening, and also those who watch us on Facebook. We appreciate you. See you same time next week as we bring you another topical issue, another important topic to discuss on our mental health show. My name is Akusia Kwatima Boachi AKB. Let's join the nation's capital for the discussion segment by kind Katsi DBS Industries.
Where dissent was crushed and loyalty was rewarded with unchecked greed. What good are monthly allowances when the party's integrity was auctioned off to the highest bidder? You claim he wanted to hand over the